Well, this morning, a new coronavirus projection from the University of Washington, this one forecasting as many as 200,000 deaths from the virus in the U.S. by October. But as ABC's Alex Prochet shows you, the vice president doesn't sound concerned.
This morning, Vice President Pence is downplaying new coronavirus concerns. In an op-ed in the Wall Street Journal titled, "There Isn't a Coronavirus Second Wave," Pence writes, "We are winning the fight against the invisible enemy," adding such panic is overblown. But many health professionals, including Dr. Anthony Fauci, warn the country risks a resurgence in COVID cases if states don't stay vigilant as they reopen. And while the vice president says there is no second wave, cases of the virus are on the rise in at least 20 states, like Florida. Just one day after Miami pressed pause on its reopening plan, the state reported nearly 3,000 new cases Tuesday, the largest single-day spike since the beginning of the pandemic. Governor DeSantis says the state will not shut down again and attributes the spike to increased testing.
We really expanded the drive-through and the walk-up sites, and now we have pop-up sites at retail locations, and that's thousands and thousands and thousands of tests a day.
COVID-19 hospitalizations are up in at least 14 states, including record highs in Arizona, North Carolina, and Texas. There, Governor Greg Abbott insists the state can handle the uptick in patients, but urges younger people to stick to the safety guidelines.
Certain counties where a majority of the people who are tested positive in that county are under the age of 30. And this typically results from people going to bar-type settings.
There's also new hope for a coronavirus treatment. Doctors at Oxford University say they've found the first drug that improves survival rates in the sickest patients. A low-cost common steroid cut the risk of death by 1/3 for patients on ventilators and reduced deaths by 20% for those on oxygen. That steroid is called dexamethasone, and if in fact it can be used, another benefit is its cost. Doctors say it can treat a patient for just $1 a day. Alex Prochet, ABC News, Washington.